Hello friends, this video is on the topic adhesion in dentistry or bonding in dentistry. Yeah, it is well said, it is not just about tying the knot, it is also about keeping the knot tight. And same holds true in dentistry. Yeah, it's important to maintain the longevity of the bond with the tooth structure. So today we'll discuss about the basic concepts and the protocol of bonding in this video. Yeah, bonding or adhesion, it comprises a complex set of physical, chemical, mechanical mechanisms that allow attachment and binding of one substance to the another. What are the functions of adhesion? It resists the separation of adherent substance. Adherent substance can be enamel, dentin, composite, ceramic from the restorative or cementing material. It allows stress distribution. It seals the interface via adhesive bonding. Adhesion invent was a turning point and featured a new era in dentistry. So there are so many improvements have been made because of difference in the bonding characteristics of enamel and dentin. So the enamel is a homogeneous structure which is very hard and it has high surface energy because it is hard and high intermolecular strength. So if something is hard, it has high surface energy. If a substance has high surface energy, it means like it can allow easy wetting. If a substance can easily wet, a 0-degree contact angle can be established as the adhesive substance can spontaneously spread over the surface. But compared to enamel, the dentin is heterogeneous structure. It comprises more of organic structure than inorganic. It is highly hydrophilic because we know it has dentinal fluid in it. It is a vital organic structure, highly hydrated, heterogeneous, and it undergo morphological, biological changes related to physiological and pathological processes. So due to difference in the structure, we have different systems that has been advanced and developed. So these are the turning points that occur from the starting during 1955 when the Bunocore, they came out with an idea of acid etching of enamel. Then we have a first generation bonding agent, which is NPG GMA based. Then total etch concept by Fusayama. Then Nakabayashi gave a concept of hybrid layer. Then there is a concept of wet bonding technique. From there, we came to the self-etching and adhesive system, and further advancement had been made to universal bonding systems. So let's discuss one by one. So this is the classification of adhesive system. Historically, the adhesive system are classified in generations according to their chronological appearance in the market. This nomenclature, like first generation, second generation, it lack objectivity as it has no scientific basis. So best classification was given by Van Meerbeek et al. As it considered their effect on the smear layer and number of steps involved in the application. So we have like 3 steps for the what we call in the fourth generation, etch and rinse or total etch technique. It can be 3-step or 2-step, which is fourth generation and fifth generation. Start with the fourth generation. It has 3 steps, means we have to etch with the phosphoric acid, we have to prime, and then we have to bond. It can be 2-step. In this, we have to have a separate etching step, but primer and bond are combined in one. Then we have a self-etch. Self-etch start with the 6th generation. Self-S, we can remember like this, 6th generation start with the self-etch technique. It can be either 2-step or 1-step. In these, we do not use phosphoric acid for etching because we use acidic monomer in this to create a microporosity in the structure, and in this we have combined the etchant and the primer. It is self-etch, and then a separate bonding layer is applied. And the 1-step, which is 7th generation, which is all in one, we combine all the 3 in one as acid primer and bond. And in the universal system or multi-mode system, it is more versatile. It gives an opportunity to decide which adhesive strategy to use. It can be accepted depending upon the situation. It can be used either as total etch, self-etch, or selective etching the enamel and self-etching the dentin. So we're discussing it one by one. So basic concept behind all these generations, like they have a basic concept, like they have to demineralize the enamel to create a microporosity into it, enamel or a dentin, into which a resin can infiltrate and it get micromechanically adhered with it. All are based on this. So this is a brief we'll discuss. It can be 3 or it can be 2. Our self-etching steps, the 2-step or 1-step. And now, regardless of how the different adhesive systems work, they have a similar compound. Relative proportion varies according to different adhesive systems. Basic composition, it contains acids, monomers, organic solvents, initiators, inhibitors, each having a specific function. Now we say monomer. Monomer is like importantly composed of adhesive systems. There can be two type of monomers, either functional monomer or cross-linking monomer. Functional monomer, it possesses hydrophilic properties, and according to functional group, it may work out distinct actions. Like if it has a hema group, it allows wettability of the substrate. If it has phenyl P, like it allows the tissue demineralization. If it has MDPB, it has antibacterial function. We have cross-linking monomers, which has hydrophobic profile. They form a polymeric matrix, which is responsible for its biomechanical behavior and for its interaction and co-polymerization with restorative material. So let's discuss etching. Phosphoric acid is used to remove both smear layer, and it removes around 10 to 50 micrometers of enamel surface, creating porous substance. When substance is porous, it can increase the surface energy and wettability, which allow fluid resin dispersion into the enamel microporosities by capillary attraction, forming micro and macro tags. The macro tags, what we say, they cover, like micro tags is after, they both form after polymerization. And this is denting etching. After phosphoric acid use, HCPO4 lead to complete removal of smear layer. It allows complete removal of the smear layer and demineralizing the intertubular dentin up to 3 to 5 micrometers. Because when we are using H3PO4, it do not modify a smear layer, it removes the smear layer. So there is a complete removal of smear layer and hydroxyapatite crystals. We'll say why hydroxyapatite is important, we'll discuss it later. And randomly arranged remove smear plugs and dissolve the peritubular dentin, and open dentinal tubules acquire a funnel shape. Like it completely removes the smear layer, open the dentinal tubules in the form of funnel shape, creating a collagen mesh into which the resin can penetrate. And this exposed collagen will act like a mesh. Create a nanometric spaces. It will create a nanometric spaces of around 10 to 40 nanometers. So after this etching process, around 70% volume of the water is dispersed around the 30% of the collagen fibrils that remain anchored to the subjacent mineralized dentin. So demineralized dentin is hydrophilic substrate. It is hydrophilic substrate which has a very difficult clinical manipulation, because we know resin has an hydrophobic behavior. So after etching, which is followed by rinsing and drying in total etch technique. And after rinsing, it is a procedure which should dry. We should allow a low level. During the drying, we should allow a low level of humidity at enamel while keeping the dentin should be hydrated. Why we need to keep our dentin little hydrated? Because dehydration lead to collapse of exposed collagen mesh, reducing or nullifying the spaces between the fibrils, preventing them from acting as a channel through which monomer may penetrate or spread. These channels, if these spaces will close, it won't allow the resin to infiltrate, and we can't have a strong bonding. So this is etching. Now come to the primer. Priming, if residual presence of solvent due to the centrifugal movement of the dentinal fluid within the monomer. Priming. Main aim of priming is to alter hydrophilic dentin into the hydrophobic. It increases the dentin surface energy, and it creates an adequate receptor of subsequent hydrophobic bonding resins. So to make a dentin hydrophilic to hydrophobic, we use a primer. It consisting of amphipathetic molecules which are dissolved in a solvent. Solvent can be acetone, alcohol, or water. These monomers have hydrophilic properties, which has an affinity for exposed collagen, and hydrophobic properties for copolymerization with an adhesive resin. It's a bifunctional molecule which has a philic property to bond with the dentin and phobic property to have a adhesion with the resins. And HEMA is the most commonly incorporated in primers. It will enhance the dentin wettability. It allows the re-expansion of collagen network. It improves bonding capacity of adhesive resins. So when we dry, the dentin is collapsed. After we etching, we rinse, we dry. There is a collapse of this. We don't want a collapsed collagen. For that, when we apply a primer which has HEMA, it will lead to expansion of the collagen, will create a nanometric spaces through which resin can infiltrate. For etch and rinse technique, wet bonding technique is recommended. More important when acetone based primer is used. A primer in this, as we told, solvents can be either like acetone or it can be like ethanol or water. So when it is acetone based, it is very important to have a wet bonding technique because acetone is not able to establish the hydrogen bond and encourage collagen re-expansion. So even excess water should be removed with a dry sponge. It should not be there. We say like how moist the dentin, this is an ambiguous concept, but it should not be over dried, it should not be over wet. Because if excess water is there, it allows the phase separation of the phobic and philic component. It will result in a formation of the blister and resin globules at resin-dentin interface. And if it is desiccated, it will lead to collapsed collagen, lead to incompatible intertubular resin infiltration. So interface is characterized by infiltrated area and superficially forming a very hybrid layer. If we are not able to penetrate this resin into these spaces, we'll have a very thin hybrid layer and that won't be have a good life. Primer in solvent should be able to displace all the water trapped within the collagen network, allowing monomer to interdiffuse. And the priming for the enamel, it should not be less than 15 seconds, and for the dentin, it should not be more than 15 seconds. And primer should be actively rubbed on the dentin surface with a disposable brush to improve the monomer interdiffusion and solvent evaporation. To complete the primer application, gentle a blast of air must be applied to promote evaporation of any remaining solvent. So we can, after applying the primer, we can put a little air blast over it to remove any remaining solvent over it. Because if any residual presence of solvent, it will lead to centrifugal movement of the dentinal fluid within the monomer and may reduce the amount of monomer infiltrated in the collagen network. Because whenever it is over dried, the water from the dentinal fluid will come on the surface and don't allow the monomer to interdiffuse. It's very important to remove the excess solvent. In the total etch technique, as we told, it can be either 3-step or it can be 2-step. In 3-step etch and rinse technique, independent coat of hydrophobic adhesive resin is applied to complete the bonding procedure. In 2-step procedure, at least 2 layers of bonding, that is primer or bonding agent, should be applied because first layer will act as a primer and the later will act as a bonding resin. And when we apply after the priming step, the adhesive resin will interpenetrate and there is a diffusion of adhesive resin into the collagen and will form a hybrid layer and a resin tag. It is very important to achieve the diffusion of monomer to the level to which demineralization has occurred completely, but there are so many factors for which we are not able to acquire that. It may be due to the superficial amorphous phase at the demineralized dentin surface. There is a parallel arrangement of the collagen fibrils in relation to the surface, and there is a presence of highly hydrated proteoglycan forming hydrogel in spaces between the fibrils. They don't allow complete penetration of monomer to the level to which the dentin has been demineralized. So these proteoglycans will act as a filters for the molecules with high molecular weight and allowing many small molecules like HEMA to impregnate at deeper level. So our superficial layer will be more hydrophobic compared, the lower one will be more hydrophilic due to interdiffusion of low molecular weight particles and hydrophilic particles like HEMA, which will further lead to the deterioration of this layer. This hydrated network connect resin tag to the base of hybrid layer. In between there is a water molecules, this hydrated layer, because they are connected with each other, they are connected to the base of the hybrid layer through their lateral ramification. It can lead to nano-sized porosities on the bonding interface. On this bonding interface, there can be nano-sized porosities, impair the monomer conversion, affecting the mechanical properties of the adhesive layer. What we call as a nano leakage, it occurs because of the fluid dispersion through this and creating a nano space on this interface. Increase in nano leakage expression is more frequently linked to the use of 2-step etch and rinse system compared to 3-step. Therefore, 3-step is said to be a gold standard. As they contain a higher percentage of hydrophilic monomers, because 2-step it contains more of hydrophilic monomers and act as a semi-permeable membrane after polymerization. And when we have a nano leakage pattern, it will lead to chemical degradation due to the water sorption of the polymer, hydrolytic and enzymatic degradation of the unprotected collagen by MMPs like metanoproteinases. They will lead to degradation of this layer. So various studies has been done that how we can prevent this degradation of the layer. Like it has been said that if we use a chlorhexidine 2% for 60 seconds on phosphoric acid etch dentin before using etch and rinse systems can to some extent reduce the level of this degradation by MMP. Now we come to the self-etch system. Self-etch adhesive system, they contain acidic primer. Here we are not using phosphoric acid for etching enamel and dentin. It is based on a concept to modify the smear layer, not removing the smear layer. It contains acidic primer for direct bonding to smear layer covered on enamel and dentin. It requires no separate etching step as acidic monomers simultaneously etch and prime the dental substrate. Thus, all byproducts from demineralization process and from the dissolved smear layer, they are incorporated into the bonding interface. So what are the advantages over total etch? Like it is a simplified technique. We don't require a separate etching step. It is not technique sensitive, like how much to wet or dry a dentin, as it do not completely remove the smear layer. So rehydration, because rehydration secondary to dentinal fluid movement is prevented and it will reduce the post-operative sensitivity. This procedure does not over dry the dentin, because if the dentin is over dried, we discussed then later in total etch technique, it will lead to flow of dentinal fluid on the surface, but here it is not occurring, so the post-operative sensitivity won't occur in self-etch technique. Demineralization and infiltration takes place simultaneously and to the same depth. We don't have a fear of like there are the monomer infiltration is not occurring to the same level as to the level of demineralization. But here both the steps are occurring simultaneously, that is etching and the monomer the primer. So we don't have the concept like they are not at the same level. There is no sub-infiltrated demineralized area in this. So what actually it is composed of? It composed of aqueous mixture of acidic functional monomer. In this we have generally phosphoric acid, carboxylic acid ester with a higher pH than that of phosphoric acid. Water acts as an ionizing medium for dissociation of these acidic protons and dissolution of calcium ions that promote the etching process and prevent the collapse of demineralized collagen fibrils. It has other hydrophilic functional monomer and hydrophobic cross-linking monomer also present. It has a co-solvent which may be ethanol or acetone frequently added to form an azeotropic mixture with the water to promote solvation of hydrophobic moieties and to ensure proper thinning, spreading and wettability. It has a main constituent HEMA, which is added as a low molecular weight water-soluble monomer. It improves the miscibility and the solubility of polar and non-polar adhesive compounds. It is water-soluble, so it improves the mixing of philic and phobic compounds. And it has an influence on the bond strength and it prevents the phase separation. HEMA also stabilizes the collagen fibril network. It don't allow it to collapse. It improves the dentin permeability, wettability, and monomer diffusion. HEMA-rich system attract water from underlying dentin, inducing a presence of water droplet on the surface of adhesive that behave as a semi-permeable membrane. So when we are using an HEMA-based system, it is very necessary immediately light cure the composite, because if the water will accumulate on the surface, it will prevent the monomer polymerization. We have HEMA-free system also, which are either ethanol or acetone based. They start to volatilize faster and this cause severe changes in the water and acetone ratio and more critical in acetone based. If you use an acetone based system, there very likely we have a difference in acetone and water ratio as it evaporates faster, and acetone do not allow the collagen fibrils to re-expand. As acetone volatile faster as a co-solvent start to evaporate and many small water droplets start gradually to emerge in an adhesive layer spontaneously and they'll disappear. But it takes several minutes and entrapment of the droplets upon light curing become more likely. So this can compromise the strength. So very strong air drying step is recommended in air acetone based system. Like we have a one bond system, if it is an acetone based, and like adper single bond which is an ethanol based. But a studies has been done, they say like ethanol based system is much better than acetone based system because acetone it volatile faster and it do not allow the collagen to re-expand. Self-etch system, it can be classified as either two-step or one-step. In this two-step procedure, first we apply a hydrophilic self-etching primer, afterwards hydrophobic bonding. In a one-step technique, it can be either one component or two component based. One component is also called an all-in-one adhesive. It combines all the ingredients related to acidic primer bonding into one bottle. It is a mixture of phobic and philic. In two component, one step self-etching system, in this the functional monomer are separate from the water. It increases the adhesive shelf life and hydrolytic stability. So water has been kept separate from the monomer. It requires additional mixing before application. It is, although it is one step, but before application we require to mix. Composition and concentration of acidic resin establish difference in acidity and aggressiveness of self-etching. According to pH, we have classified them according to ultra mild, mild, intermediate, and strong. Ultra mild has a pH of more than 2.5, mild has a pH of around 2, intermediate between 1 and 2, strong has a pH of less than 1. In this, there are some functional molecule which has an evidence of additional chemical interaction with the calcium hydroxyapatite. Because here we are not completely removing the smear layer, there is still a presence of calcium hydroxyapatite in the smear layer. So there are some functional acidic monomer like 10-MDP, phenyl P or 4-meta. They establish the ionic bond between their functional group. It can be either phosphate, phosphonic acid or carboxylic with calcium of hydroxyapatite depending upon the decalcification adhesion concept. Now what is this concept? They all can have an interaction with the calcium. Acid can have a bond with the calcium of hydroxyapatite, but how long that will stay, it depends upon the, like all the acids are able to establish a bond. But whether the produced molecule will remain bonded or will debond depend upon the stability of formed calcium salt. And that stability is inversely proportional to the acidity of the monomer. If the monomer is highly acidic, it is able to form a calcium salt, but that salt is not able to remain for long. It will debond. In cases of high pH, which is more aggressive self-etch system, we are able to form 2 to 5 micrometer thick hybrid layer along with a resin tag. In case of intermediate, like this is a case of intermediate self-etch system, which has a pH of around 1 to 2, it will form a superficial and partial demineralized layer and some of the hydroxyapatite calcium content with an ability to form a chemical bond with the functional monomers. And low pH systems which has a pH of more than 2, it will demineralize dentin partially and superficially forming smear layer and a plug and amount of hydroxyapatite, and hybrid layer has a very much less thickness, and hydroapatite crystals has an additional chemical addition process in it. The one-step self-etching system, it creates a very thinner adhesive film. Therefore, their application is required in 2 or more layers, employing an additional single-step application of hydrophobic resin that will improve the performance and the bond strength and interface step. So we are using a one-step self-etch system because one-step self-etch system, it creates a very thin films. So the interdiffusion of the monomer into the dentin will be not very strong. So we need to, and it is a very hydrophilic system. So we need to apply an extra layer of hydrophobic resin. Self-etch process varying degree of variability due to difference in acidity and hydrophilicity. But it has been said that dentin bonding optimization with the self-etch system associated with the presence of 10 MDP. We are saying we are using a self-etch system with a one step and it has a 10 MDP, it has good optimum properties because MDP is the most promising acidic functional monomer. It forms an ionic bond with the hydroxyapatite calcium and form a regular nano-layered structure on the dentin surface within which calcium salts are deposited. For example, we have a clear fill SC bond, clear fill protect bond. They contain MD. Yes, dentin bonding system. It can be for the protection, informants of the tooth structure. After we prepare a tooth structure for indirect restoration, it has been said that they can be used for the protection of the lower dentin and can prevent the secondary caries. This film coating is based on all-in-one adhesive technology, which are based on self-etch. It will form a barrier-like film on the prepared dentine. Like this is a prepared. I have prepared. This is root. I have prepared a dentine. I have cut a cavity, and over that prepared dentine, if we apply a layer of self-etch all-in-one, which are based on all-in-one technology, it can serve as a to protect the dentin structure after the preparation. It will create a new zone beneath the hybrid layer. Like this is the hybrid layer, between that there is a formation of a new layer which is acid base resistant zone. We call it acid base resistant zone or a super dentine that will help to prevent the secondary caries. It has also been said that on the root surface coating with a dentin bonding system, it is effective for protection against caries, erosion and abrasion. Now we have universal adhesive system. The trend in adhesive technology is to simplify, either by combining etching and primer bonding, or all in one, by reducing the application step, shortening the clinical application time. So the aim is to provide a single product in all situations. It can be applied with etch and rinse or self-etch. It allows clinician to have an advantage of etch and rinse on enamel and simplified self-etch technique on dentine. It is a mild or extra mild profile. We can use this system and either of the ways depending upon the structure we are using. On enamel, we use phosphoric acid for etching. Low acidity of this system lead to superficial enamel demineralization. So in this, because it is based on mild or ultra mild concept, we require a separate etching on this. Dental etching with phosphoric acid, it will lead to excessive demineralization. So we are not using it with dentin. So we have discussed all the three systems, like what are the advantages, disadvantages, and what it contains. Now come to conclusion. Increasingly development of different type of dental adhesive system, it will create an uncertainty among clinicians like which to use during a practice. It is not only mandatory to rigorously follow a recommended protocol for adhesive procedure, it is also crucial to select a correct adhesive strategies as a function of restorative material. Like etch and rinse is better on enamel, two-step self-etch containing MDP, it is more suitable for dentine. If we are doing an interior restoration where enamel prevails over dentine, we can go for etch and rinse. But if in our posterior, we can go for selective etching technique, etching and enamel separate and using self-etch technology on dentine. I hope this has cleared some concept and able to know something new. In the next video, we'll discuss about how the intraradicular adhesion is different from our coronal adhesion. Thank you.